So I thought maybe I'd spend a few minutes talking about the science and how this all works. So there is this neurologic concept called proprioception. And proprioception is, how does your brain know where something is in space without you looking at it? So for example, if I were to hold up my arm while I'm looking at you, I know exactly where my arm is because the tension of the ligaments and the tendons and the muscles, my brain knows exactly where this is. So how does my brain know where my jaw is in space? Well, there's this little jaw joint over here called the TMJ, temporomandibular joint, and there's a capsule around the outside of that joint. And that capsule is filled with fluid, which has a lubricant inside there, so that when you open and close, either speaking or talking or doing whatever you're doing with your mouth, you're able to keep that little jaw joint lubricated. The other thing that your body wants to know is, where is your jaw in space? So in order for me to articulate words, I have to have my jaw moving a certain way, I have to have my lips moving a certain way, I have to have my tongue moving a certain way, and my vocal cords. All of those things simultaneously have to be working in order for me to create a sound and to manage that sound by shaping my tongue and my lips and my cheeks and my jaw. So all of that stuff is complicated. Well, it turns out that proprioceptive fibers, these nerves, actually sense all of this stuff, and they tell your brain kind of where everything is in space, and then your brain figures out a way to manage the position of all of those things and allow the motor function, which is the muscle actually contracting or loosening up, to happen. So there's a sensory component to proprioception, and then there's a motor component, which is going to make all of this stuff move around. So the jaw joint, the little capsule, has these little nerve fibers around there for proprioception to know how much your jaw is opening and closing. And the nerve fiber that senses all of that is called the auricular templar nerve, which is a branch or one of the nerves that make up the trigeminal nerve, which is the fifth cranial nerve inside your head. Typically, cranial nerves will terminate in the brainstem of your brain, and the brainstem is the portion that connects the big part of your brain to your spinal cord. It's probably one of the oldest parts of your brain, and there's 12 cranial nerves, and some of the cranial nerves would be your ability to see, your ability to smell. Those are the two biggies, and then there's other cranial nerves that have sensory and motor functions to it. So for whatever reason, the auricular templar nerve terminates in the thalamus of your brain, not in the brainstem, and who knows why nature did this, but they did. So the thalamus of your brain is the motor processing portion of your brain. So what does that mean? Well, the idea of this appliance and the science behind all of it came from a medical procedure called deep brain stimulation. So in movement disorders, what neurosurgeons will do is they drill a hole in your skull and they insert a wire into your brain, and they're aiming for the thalamus of your brain. And then once that wire gets to the thalamus of your brain, then they hook up like a little battery pack to the wire on the outside, and every single time you have a severe movement disorder, they can provide a little electricity, and it kind of creates a stimulation of the thalamus, and the movement disorder decreases. So how do we create an electrical signal to the thalamus of the brain without actually having to drill a hole in your skull and putting a wire inside there? Well, it turns out that if we can create an electrical signal from the auricular templar nerve, which terminates in the thalamus, then we can reduce the amount of motor signal going back out to your body. So how do we do that? By opening up the jaw distance. So right now, if you open up your jaw bigger, the auricular templar nerve has just sent an electrical signal to the thalamus. So we're creating an electrical signal naturally, the same way that you convert, make an electrical signal artificially. So we're creating an electrical signal from the auricular templar nerve going back to the thalamus. That electrical signal then turns off the motor signal going back out to the body, and in the patient with Tourette syndrome or chronic tic disorder, it ticks less. So anyways, that's what we kind of figured out, and that's what we did with our appliance. So it's the opening of the bite, the electrical signals go to the brain, which causes these kids to tick less.
Fascinating. Wow. Thank you, Dr. Balanoff.
Thank you.